we're going to shift a little bit to your book you wrote, Under the Gun, an ER Doctor's Cure for America's Gun Epidemic. And you share stories of dealing with gun violence in emergency rooms. And I think you had some particular motivation for writing that book. Would you care to share that with our audience?
Yeah, the main reason that this book got written was because the NRA decided to tweet out in 2018 that physicians need to stay in their lane and not talk about gun violence prevention, which most of us that actually deal with this on a day-to-day basis, especially those of us that have advanced training in it, in the policy side of it, were highly offended by that remark and fought back with a hashtag called "This Is Our Lane," and maybe 30,000 or so of those hashtags went out in like 2 weeks after this had taken place. So, I mean, I was part of like that group of people that were writing op-eds and maybe doing some media interviews here and there, talking about why physicians do have a right to talk about firearm injury prevention. And then maybe a year or so later, a colleague of mine reached out and was like, you should write a book about this. And I really didn't want to. And she kind of tricked me into doing it. So if you look at the book, you'll see Seema Yasmin's name in really small print because she told me she was going to be my co-author. But then when it came down to it, she was like, okay, I got you going, pushed you on your way. And so she's like, my name doesn't really need to be on there. I was like, well, it needs to be on there because you did write some of it. But we'll have mine big and yours small, and that's sort of what happened. So it's all Seema's fault that I wrote this book, quite frankly, because otherwise I probably would have just stayed on Twitter, harassing people on Twitter. That's kind of what I was doing back then. So then I spent the next 5 years writing a book.
Wow, and you found out how hard that really is.
Yeah, we signed the contract with Johns Hopkins Press in the end of 2019. And I thought, I could get this done in the next couple of years, have it published in time for like the 2022 midterms, and then COVID hits, right? And I'm like, okay, maybe I should do other things like take care of patients and trying not to die, that kind of thing. But it just, I've never read a book like this before. The process is a long-ish process. During that time frame, I happened to read President Obama's book, A Promised Land. And like in the beginning of his, he talks about how it took him 5 years to write it. So now I don't feel bad because I don't have the resources that the President of the United States has. And I got it done in the same amount of time.
Well, at least you didn't have to go through the Department of Defense vetting process to make sure that you didn't have anything classified in there. So I think I'm really interested in hearing what you express in the book, because I got two confessions. I have not read the book. But on your website, there's a very interesting statement that I think a gun owner like me actually would very much appreciate. It says, we are not anti-gun, we are anti-bullet holes, which I think is a remarkably prescient and mature approach to this whole problem. So tell us a little bit about what specific policies that you have in mind that could save lives by helping prevent gun violence in the first place.
Yeah, so first of all, let me give all credit to Dr. Esther Chu for that statement. Which she tweeted out one day, and the rest of our group kind of rallied around that, and she allowed me to steal that for all eternity to use. But there's many things that are evidence-based and proven based on the RAND Science of Health Policy textbook that you can find on their website. And just a few of the ones that are out there, there's these things called domestic violence restraining orders. If someone has this restraining order placed on them, not only does it say you need to stay away from the person that you are abusing, but we also allow police to go in and remove guns from that situation. And that's extremely helpful to prevent intimate partner homicide. Things like background checks help reduce homicides. And the problem that we have in today's society is that about 22% of all firearm transactions are done privately without intervention with a federally licensed dealer. And so therefore, if you're the 1 out of 5 persons that wants to get a gun and probably doesn't want to go through official channels, go buy it privately, I imagine there's more people that want to do that happen to be criminals than people that are trying to go to the store to buy it. So that's one thing. One of the most effective ones we can focus on is safe storage or child access prevention. It helps reduce unintentional deaths from firearms. And then it gets into some more controversial items too. One of the things when you read it, I never argue for anything like an assault weapons ban, because the science of gun policy doesn't say that that's necessarily effective. And we could probably get into sort of, things like power calculations and mathematics and stats if you wanted to, but I imagine your readers would be bored of that because it's an adrenaline zone podcast, not like a statistical podcast. And that would bore me to tears having to hear about math. But in one of these editions, it went from the 3rd edition to the 4th edition of this book that by Rand, it actually talked about banning large capacity magazines. And I think that kind of makes intuitive sense that if someone has to reload a little bit more often than not, maybe you can reduce the number of people killed in a mass shooting. And so that's one of those things in there. And one of the last ones that I do want to mention is stand your ground laws, which, I'm also a gun owner too. And I don't carry. But for those that do carry, they have a right to protect themselves in their homes. Some states make it you can protect yourself in your car. Other states make it any place where you're allowed to be. And I think what that opens up is a situation, especially like in Houston, where driving is terrible. You get into a road rage incident, you get out of your car and you start, talking to the next person. The person makes you feel threatened. Now you're authorized to shoot them. And I think that's where we could see that some of the things that we do in our society might be a little bit too far. And I would argue maybe we should pull some of that stuff back.
Yeah, and that's the problem is, of course, that there's this slippery slope thing where some people will say, well, you put one restriction on, you're opening the door to total banning of guns. And I don't think that's what any of this is about. And I think there are some pretty reasonable things you can do that you probably have in your book that would dramatically reduce gun violence. And so you don't have to see it so much in the emergency room, right? That's the whole point.
No, absolutely. I list out the things that are evidence-based and kind of leave out everything else that might be considered common sense or whatever people want to call it. And I'll give a little bit of a preview. There's a group at Tufts that's been working on something with folks like you, that are gun owners, folks like me that are more on the gun violence prevention or the injury prevention side of things, and actually getting us all together in one room. And it's maybe about 22 of us, I think, and we voted on all these different policies. And we came up with a list of policies, like 8 different policies that may be helpful, also evidence-based, that could save people's lives. It's not yet ready for release, but I just wanted to kind of tease that and put it out there.
Well, that's a really interesting concept in the drug overdose prevention world. And I have a drug overdose prevention nonprofit, is getting, those two sides together. We call it getting the meat eaters and the leaf eaters together. And surprisingly, it works. You can get law enforcement and you can get, people who are advocates for, needle exchanges and that sort of thing in the same room, and they actually can start agreeing on things. So I think you got a really good project going there. That'll be good.
What are the major barriers that you think are in addressing some of these issues and some of these, the implementation of these policies that you think would be most effective? Is it ignorance? Is it lack of willpower?
Politics.
Yeah.
It's politics. I don't think it's necessarily ignorance. I think that people can recognize what will work, what won't work. And I think just having conversations, I remember having a conversation with one of the panelists over ERPOs, or emergency risk protection orders. Some people call them red flag orders. And, that person brought up their concern over due process issues. And we had a conversation about how that really goes into play there. And I think, it was interesting because on one side they saw, and I can't remember whether it was the homicide aspect of it or the suicide aspect of it, but on one side, that person saw that it was possibly useful and they could get behind. On the other side, they couldn't get behind. And it just took having that conversation to be able to get to a point where we could finally get something to happen. We are terrible at doing that in today's public forum because our politicians are so polarized and they will not have conversations with each other on anything of substance for certain polarizing issues like this. And we live in this age of social media where any quote or soundbite gets taken out of context and circulates around the world within an hour, as opposed to, quote unquote, back in the day when our politicians could sit in the cloakroom in the Senate and, smoke cigars and probably drink themselves into a stupor and have a conversation that no one knew about, and then could come up with a compromise. And I think that's one of the things why this process has been helpful, because I think it can get the politics out of it and get people that just want to fix a problem to discuss it in ways where they don't have to cater to their constituency.